Yeah, my name is Victor. I'm going today to take you through history taking, the general history taking, which involve biodata, the chief complaints, HPI, review of systems, past medical, surgical history, personal social economic history, family history, and the summary. Let us now start with the biodata. The biodata, these are the things that describe the personality of the patient, or these are identification details of the patient. It involves mainly the name, the age of the patient, the sex, the occupation, and the address where the patient comes from. The biodata are followed by chief complaints. These are CC. The chief complaints, these are the symptoms, problems, or complaints that encounter the patient to come to hospital. The complaints contain the durations of symptoms in days, weeks, or months, or either years. The symptoms should be arranged in chronological manner. In this case, one should start from the chronic one and to the acute one. Let us now check on HPI, that is, history of presenting illness. The history of presenting illness involves the description of the disease process. It also involves expanding on the main complaints associated with the disease. The main complaints should be checked first and conclude with the minor ones. This will help you to end up in diagnosis of the disease. Let's now check on the review of systems. In this case, the review of systems, one has to practice open-ended questions with the patient. The patient should be motivated to give out other systems so that he or she do not feel with anxiety. This will help the patient to feel well. If the patient doesn't cooperate, practice also close-ended questions by asking specifically about this respective parts and take the correct history, past medical and surgical history. In this part, we look at the patient treatment history in trying to relate to what the relevant recurrent presenting illness. We also evaluate its recurrence. It involves history of the previous admission. Number 2, history of the previous surgeries, history of blood transfusion, history of food allergy, and many others. In past social and economic history, one should check for marital status of the patient, the smoking status of the patient, alcohol status of the patient, drugs, and if the patient smokes, please know the amount of cigarettes one take in a day patient take. Alcohol history, know the amount of alcohol a patient takes in a day. Let us now check on family history. In the family history, one should check for parents, the condition of their parents, the siblings, position in the family, history of the twin if it is present in the family, history of tuberculosis conduct in the family, history of cardiovascular disease if any. of the siblings have been involved with. Then we end up summarizing the whole story of the patient. Summary simply means in this part, you take time and give out a brief summary about what patient has presented about, starting from the main of concern areas to the minor areas. The details should be presented in a systematic manner. Also, one should also write a prediction about what he or she might be suffering from. But viewers, remember, before the history checking, try also to seek the consent from the patient. Also, work try as much as possible to see the general examination of the patient before patients even tell you what they are suffering or what are the symptoms are they going through. But to take a good history, it's better to seek consent from the patient so that the patient can cooperate fully to you for full history taking. That's what I had for you today. Thank you. Follow my channel. No more. Thank you. See you.